That's what the noise is in the background, people. Okay, so this lovely lady in front of me has just said to me that, what did you say exactly? Something along the lines of you've had just about everything thrown at you that could be thrown at. So this
Absolutely.
she has beautiful children behind, but they all have different problems. When I asked if they would come and maybe talk, no, because the vaccines have taken that ability away for them to be able to have the conversation that is needed right now.
That's correct.
And that is not okay. Okay, I'm just going to plug some of these phones in, charge them up, so we keep our charge. Okay, tell us your name.
Lee Burnett Goldsmith.
Lee Burnett Goldsmith, thank you. And how many children have you got?
4.
4. And tell me the ages of all your children.
My oldest is 26. There's a big span between them all. And then an 8-year-old girl, a 6-year-old boy, and a 2-year-old. She just turned 2 recently.
No, is it same dad with them all?
The youngest 3, same dad.
Okay. So, of all 4 of your children, are they all affected from the injury from vaccines?
3 are still affected. 1, it resolved later in life when he...
The older one?
The oldest one. When he realized, long before I did, the dangers of vaccines, and he refused them when he went to college. And
he worked that out on his own?
He figured it out on his own. He was a red shirt for the Arkansas Razorbacks. It was a walk-on wide receiver a few years back, and they wanted him to get the flu shots. They wanted him to get everything.
Okay, slow down a second. What does a red box for a red sock?
It's he was chosen in open tryouts, and that's, from my understanding, that's about a 1 in 10,000 chance. From what I've been told, I don't know a great deal about football. I'm a little embarrassed, and so he is kind of sitting on the sidelines until they decide to use him.
But he's good.
He was good for them to choose him. Yes.
Okay. Now this is not the first time that we've heard of athletes being injured or harmed by the flu vaccine at all. So what happened? He was asked to have the flu vaccine.
He said no, and they kept pushing, and he refused it, and then they stopped pressuring him after that.
But did they still let him be on the team?
They did. He had all of his vaccines on schedule when he was growing up, but there were far less. He was born in 1991, so there were far less. So it affected him in the he had just environmental allergies that resolved when he changed his diet later on, and
what did you think when he said no, though? You're his mum.
I thought he was crazy. I said, just get the vaccine. It's not a big deal. He said, but I would be getting it twice. I've already been vaccinated for this. I want my records. And he was having a hard time getting them. And, I kept pressuring him. I didn't know any better. And
which leads me on to, you were a big pro-vaxxer.
Yes. I thought people were nuts. And I really thought it was almost abusive. I remember once reading an article about we're not vaccinating their children, this couple, and I thought they should be arrested. They should have their children taken away. And
because they're going to spread polio, measles, mumps, and our kids are all going to die.
And we should follow everything the doctor says. Right. Absolutely. And not knowing that I had children sitting right in front of me as I thought about this article that were vaccine injured. I didn't realize it yet.
Where do you think we got that from, our pro-vaccineness and our belief? Do you think we just got completely brainwashed by media and school and things like that?
I do. And we're taught to believe everything that the pediatrician tells us, that our doctors tell us, the specialists tell us. And so what was not common years ago, we're told it's common. Oh, that's common. That's not a reaction. When they're having reactions to vaccines.
Okay, so you still haven't worked it out. Your son has. Then you go ahead and you have 3 beautiful, and they're on the bus behind us, children who really are absolutely stunning. And one's a feisty little thing, I tell you. And so, absolutely devastating consequences of you vaccinating your children. It's breaking. So your daughter looks like she's the eldest.
Yes.
How old is she now?
The oldest is 8.
Okay, so when you are pregnant with her 8 years ago, you're still pro-vaccine.
I was.
Now your new husband,
We've been married a little over 10 years, and he is, I thought he was a crazy conspiracy theorist. He asked me not to vaccinate them. He asked me over and over and over.
Bless his heart. Now, why? What did you think he was just a nutbag hippie?
I did.
Crazy man.
In that sense,
that
in
you
that
loved.
regard, yes. Anything else I would listen, but that, I had my mind made up. I was very stubborn.
So what did you say? I'll deal with this. I'm the mum.
I just didn't tell him, and I took them to the appointment.
He didn't know?
Well, he was at work, and I got him vaccinated.
So he thought they were unvaccinated.
I told him, and he would see symptoms, and he'd say, I told you not to vaccinate them. And we didn't really realize.
What's his profession?
Actually, he was a general manager in the furniture leasing industry at the time.
And what made him know what we didn't know? How did he know that? What was going on? Was it his gut feeling or what?
Growing up, he was affected actually by vaccines. He had severe allergies, and he had to get many, many shots. And so it affected him. He strongly believes, and I do too. We sit down and kind of figured it out after seeing what happened with the children.
Are you guys still together?
He is and this is how vaccines affect families. I'm being real here. He is in another and separated, and while we dealt with the vaccine injuries differently, I had no choice as a mother but to be hands-on and take care of them and deal with all that was thrown at us. My husband regressed, and it affected him. He regressed into alcoholism, and he just, has been restored in that sense, and has, his life has turned around. But for a while, it affected him in that regard. Our marriage, it tore our marriage apart. He had a lot of guilt. Our children were very sick.
Yeah, okay, let's talk about your kids now for a second, and bless him. And peeps, do not judge. I know you don't, because our peeps are so great. It is easy to go down the alcoholic, whatever your poison addiction, self-medication, whatever you want to call it, route. Very, very easy when your soul is torn in half. Okay, so tell us about your daughter. So she's born. Did you get vaccinated when you were pregnant with her?
I did not with her. And then at around day 2 or 3, she had the Hep B and vitamin K. Yeah. And around day 2 or 3, I thought, I had a C-section, so I ran in the bathroom and thought I'll leave her in the hospital crib right beside the door and try to rush out as quick as I can. I didn't want to leave her alone. When I came out, her face was a bluish purple color. She couldn't breathe. And I picked her up, tried to pat her on the back. She looked like she was almost having a seizure. The OB nurses, I had to run out and yell for help. The OB nurses came in, the pediatric nurses came in. I thought she was going to die. And they were fussing between each other, arguing. One blaming the other. You didn't suction enough mucus. The other saying, no, it's just, we need to change the formula. These, almost like a Sandifer's type of syndrome or seizure, very different. It went on for 2.5 years and then returned at 4. And returned for a short time. And when we thought we were out of the woods with that, with her outgrowing asthma, the acid reflux was so severe, I had to take 6 changes of clothes for her if I was going to be gone all day. She would vomit, and they told me it was normal, that projectile was across the room. I said, it is across the room. It's really bad. It's all day long. And so...
And that's normal, is it?
That's what they said.
Projectile vomiting is normal.
And she didn't eat for 4 days after a flu shot. Also, she had all of her vaccinations up until the 4-year-old vaccinations I did not get. The ones they have for kindergarten at 4 or 5. I stopped at that point. But she, 2 months after we got the baby out of the NICU, and she almost died. We almost lost Sophia, the 8-year-old, from type 1 diabetes, and she had to be life flighted.
Right, and how old was she when she got type 1 diabetes?
She was 6. So this month...
Have you seen the inserts of some of these vaccines?
Yes, I have. The Tdap and the DTaP, yes. And I understand that it is linked to other vaccinations as well.
Do you have any idea how many children her age and younger are now being diagnosed with type 1 diabetes? And especially we're hearing from teenage girls that take a gap year or go on a mission trip that for some reason they're being affected more than the boys, is what we're hearing. Type 1 diabetes is becoming a normal condition for a child or teenager to have.
And it's a very serious condition. People, and I want to clarify, people think that all diabetes is the same. They say this is a very rare diabetes. It is not anymore. It is, she has to have shots for every meal. She cannot eat unless she has a low blood sugar, or I have to monitor her. I don't go to sleep till 2 in the morning.
So talk to us about what her life is like, because many parents say it's the most devastating thing to have to watch your daughter or son have to do what they have to do. To tell the peeps about it.
She checks her own blood sugar now. She's been doing that for a while.
How does she do that?
10 to 15 times in a 24-hour period. She has to poke her finger all day. Most people don't even like to be poked one time, especially an adult. She has to have a shot with every meal. She cannot eat
in
a
her
meal.
leg or something.
We can do the side of the leg, in the stomach, the arms, and so she has to have another shot once a day for another type of insulin. We have a life-saving shot for her in case her blood sugar drops so low. I mean, she could die.
What do the white coats say that is the reason that your daughter at such a young age has type 1 diabetes? What is the answer to this?
They said it must be hereditary. We have no type 1 on either side.
And just to be clear, type 1 diabetes and type 2 diabetes, totally different things. If you don't know what they are, look them up.
It's not from eating bad food.
Right. No. Type 1 diabetes is the new norm in our children. This is extremely serious condition.
Yes.
And is there a cure for this?
Every day she's at risk to lose her life if I don't monitor it closely. And they say there is no cure.
They're bringing a vaccine out for it. Did you hear that?
Yes, I did. And she won't be getting it.
Thank you.
Yeah.
So all's good, peeps. A vaccine for type 1 diabetes on its way. I think it's out. It's having trials right now. Not. So your daughter, for the rest of her life, some people claim they do have ways of curing it. I don't know. I know nothing about this. But as we know it, this is a lifelong condition.
Yes.
And if not kept on top of it, has catastrophic
It does. It does. And that's something we face on a daily basis. If not monitored all day. If I don't stay on top of it as a mother. So it takes away the life of the child. It affects the life of everyone in the household as well.
Yeah.
It's very sad.
We're really, really, truly sorry. So she gets diagnosed with that. That's where we are with this story. Where are your other two at this stage? Where are we?
My son, I have Lyme disease, and they are positive for it as well. And I did not know that when they were born. And my son, I asked for them to take him early. I was in a lot of pain walking around, and so they took him at 37 weeks and a day. They said it was safe.
You had any vaccines while you were pregnant?
Not when I was pregnant with him, yes, I had a flu vaccine.
Did you?
Somewhere around 6 or 7 months when they offer it, and I thought it was safe. And I want to say the OB I used, she delivered all 3 of them, and she's wonderful. And she was very prayerful through each thing. And I don't believe, and I know there's different cases with everyone, I don't believe she would have done it had she known it would have harmed him. I really feel confident in saying that. Some others I would not. So when he was born with a plethora of issues. He had 2 holes in his heart. That resolved.
You're talking about the boy behind you?
Yes. He had 2 holes in his heart. He had a mystery infection that they said they were going to call pneumonia. He had to have an emergency blood transfusion for severe anemia. He was having severe chest retractions, and his oxygen levels were very low. They said actually lower than some of the babies born younger than him. I did refuse all shots for him. I don't know about the vitamin K. I can't say. I know the Hep B. I believe they did give him vitamin K. And then he had some eczema, just, baby eczema, not anything really bad. Over a few months, acid reflux developed, not as bad as his sister. So we would go down the road, and driving 15 or 20 minutes down the road in Montgomery, Alabama, I would look back, and they would be covered in vomit. And I would have to take changes of clothes for both of them and a towel. How was that normal?
What did the doctor say about that?
Normal. I didn't even question them anymore.
Everything's
I
normal,
gave up,
yeah?
and I was starting to get very frustrated at that point. He started developing food allergies, and at 10 months old, I think that was not long after he had, and actually I didn't purposely do a delayed schedule, but it just happened that we ended up doing it that way. He went into anaphylactic shock from a peanut allergy. And that was from the 6-month vaccines that he got late.
Okay, what happened? How old was he?
He was at 10 months old, at 10 months.
Describe what happened so we know.
He started getting hives, and he went into respiratory distress. It was kind of a slow reaction, a little at a time. We had to rush him to the ER, and luckily there was not any organ damage or organ failure, but it was very scary. And then it happened again as I was learning about this allergy. Then he started developing more allergies.
Wait, so with the peanut allergy, who told you it was a peanut allergy?
I guess the ER figured it out. And actually he broke out in the hives after having an apple with peanut butter that he had grabbed from his sister.
So here's what I'm trying to get at now. So you say he's had an apple with a peanut, whatever.
Yes, and he was later tested.
Right, and they say...
Yes, they said it had to be the peanuts.
Has to be peanuts. Yeah, if you say he just had some vaccines, it's not the vaccines.
Right.
But straight away they agree with you.
I didn't even think of the vaccinations at that point.
No, but it's just
and he had a flu shot as well. Then 6 months later, I still didn't know any better. I got a flu shot. And they actually, when I brought him in, they gave that, but they said...
Who had a flu shot? You or him?
My son.
Yeah.
After all of
with
that.
his peanut allergies and everything else.
And he developed an egg allergy, a garlic allergy. Sure. This child, I could write a list of all that he reacts to. Then he started to regress on his speech. And making eye contact with me, he began to sit in a corner and rock back and forth. And I started researching. I ran across information about vaccinations as I was researching Lyme disease for my sister. She also has Lyme, and I began to realize what was going on. And I stopped the vaccinations. I got an exemption, and I said no more. And then my daughter, he got the autism diagnosis, and I'll fast forward to the 2-year-old. I said, okay, we're not doing any more vaccinations. So I asked someone, is the vitamin K shot safe? That was the only one. They said, oh, no, that's the only one you don't have to. I had no idea until I read what Marcella
I thought hepatitis A was the only one we didn't have to worry about.
That's what I thought.
Or was it the rotavirus that we didn't have to worry about?
Yeah, that's what I've been told on all of them, the same thing. And so finally I said, okay, I'm going to allow her to have the vitamin K shot. I didn't have enough time to mull it over. She came a month early. I did not receive any vaccinations in that pregnancy. I ate very healthy and all organic diet, took supplements. I thought I was doing everything right. And she got the shot, and then it was, I believe, the next night, after she was born, they had to intubate her. She went into respiratory distress. We almost lost her. And they told me the next morning. They didn't bother to call me and tell me that night when it was going on, when I was in the hospital. So I've literally almost lost all of my children. Diabetic shock. My daughter being in diabetic shock, anaphylactic shock, my other one being intubated as a newborn. It has been, there are no words to describe
the pain.
There is no time in a day. My day is literally being a caregiver all day, 24 hours a day, which I gladly do.
Are they all at home with you the whole time?
They are. I did not want to put them in school for someone to tell me that they needed medication, or to tell me how to raise them and what pharmaceuticals to give them. Of course she gets her insulin that's full of GMOs, because we have no choice. We have to keep her alive. But
the insulin's full of GMOs?
Yes.
I didn't even think about that.
Yes, it is. I have no option. And
that's terrible.
It is. And I believe they know all of this. I believe it's very well.
Someone's asking
out.
what it's made from.
I don't know all the details. That's not been a focus of all my research, because there's been so much going on. But it's derived from pork, is my understanding, and there are GMOs in it. That is about the best I could say.
My goodness.
It's been...
Are you on your own?
I am right now. And my husband and I are working things out, and God has been good to us. And it's taken a lot of prayer, many nights of praying over my children. And my son, there is a positive to this. I took dairy out of his diet, and I started trying to do things that I thought would get him better. I didn't want to listen to everything everyone else was saying. If they told me something negative, I would not listen. I said, he's gonna get better. He's fully conversational now. We actually can't get him to stop talking, and I see a full recovery in his future. I really do. But right now, once in a while, he may get under the table and bang his head. He may have a meltdown in public, but it's not as frequent as it used to be. But we do deal with the morning meltdown.
And what about your daughter? So she's how old? 8, you say?
She's 8.
And she's got type 1 diabetes, and you say selective mood?
She regressed. Literally around that time, she just stopped talking to people. She will talk to the family. She might, if she feels really comfortable around certain people, she'll talk to them. But she was the most outgoing child you can imagine.
Sad.
And it's changed her.
She's so beautiful inside of that. You can see all your children are. It's just so wicked. It's so wicked what they're doing. And it breaks my heart that she has to jab herself with this stuff.
I know in one regard, a vaccination caused this. I firmly 100% can safely say that. But then we have to give her shots in return all day long. She gets 5 or 4 bare minimum daily. Bare minimum.
Now, look, okay, there are some people that want to give you some advice, whatever.
Sure.
Could they contact you on Facebook?
That's fine.
Okay, so tell them your name on Facebook.
Okay, it is Leigh, Leigh, Burnett, Burnett, and it's hyphenated, and Goldsmith is the last name. Leigh Burnett Goldsmith. And anyone is welcome to contact me. I very much believe
somebody on We Are Vaxxed. Sorry, it went so fast I couldn't read it or see who it was. My eyes aren't that good. I have not got my glasses on. But somebody on this Facebook was offering some kind of help. It just went too fast. So if that person could contact Leigh Burnett Goldsmith, and anybody else who wants to either just give love.
Sure, I'll take it.
Or we could all do with some love. Anyone that can offer any advice for these, they're literally 3 beautiful, beautiful children, and it's just not okay that this has happened. It is not okay. Medical professionals, if you're listening.
And I have, the guilt is just unexplainable. I have almost a degree in biology. And then I came back years later. I'm in ministry school, and I'm completing my degree in Christian counseling. I think I'm a professional student, almost 8 years of college. And here I am, well educated, background in biology, and I couldn't figure this out. And
well, you're getting a lot of love.
Thank you.
And someone saying she's an amazing mama over on We Are Vaxxed, and people here just saying, thank you, you're part of our family.
Thank you.
We're worldwide. We are doing our own people study for the people. All of us were either pro-vaccine or did not know. And so now we are listening to each other, which is what the doctors should have done, and what the people hopefully know. We just don't want them to suffer this. But trust me, Pete, behind this lady, this mama here, are 3 very, very beautiful children, all with severe injuries.
Yes,
and it will break her heart, but we can't bring them up here because of their issues. I mean,
correct.
They're not 3 children that they should have been.
Correct. And if I may, I would like to give someone a picture of what my day is like.
Yes, please.
If anyone's watching, I want to say, if you're on the fence about vaccinating, please hear what I have to say about children. There have been moments where I'm trying to get assignments in by 11 o'clock at night, and then I homeschool during the day. I stay up to make sure the blood sugar is okay with my daughter so she will live through the night. Till 2 or 3 a.m. I stay up some nights, sometimes all night. And then I was nursing a baby at one point also. I get up in the morning, I deal with meltdowns. And there have been times where I'm trying to meet these deadlines. I've got a daughter saying, I'm blood sugar's dropped. I need a juice. I need to check my blood sugar. I've got a child having a meltdown. This is all going on at the same time. And then now coming up, 3 days of speech therapy a week. The youngest one has to have food therapy. My son has to have food therapy, possibly physical therapy, occupational therapy, speech therapy. The little one will have 2 therapies, occupational and food therapy. And that's just from one shot, just one. If you think the vitamin K shot's okay, it's not.
No, it is not.
So that is a glimpse of what my days or my weeks are like. And I juggle a lot purposely because I want to help others. I want to get through this, and I'm going to help others.
So we set up a Facebook page called AT Peeps Place, where people can post on there and chat if you need help. I set it up like that. It should be set up like that.
Okay.
It's because on We Are Vaxxed and Periscope, we have, for whatever reason, we can't do that. We need a 24-hour. So if you are in any kind of need of love and someone will always be there. That's the whole idea. Now you have written a poem,
Yes.
haven't you? Peeps want to hear your poem. Can you read it to us?
I write. That's one of my great passions is writing poetry on the side and it's helped me through a lot. And before I even went through all I did with the autism diagnosis and then my youngest one, I wrote it just going through what I did with my daughter. And this is one that I picked out specifically for today. Some of you, I certainly don't mean to offend anyone, but I have very strong faith in God. And that's all that's gotten me through, I will tell you. And it's called Jesus is Present in Our Sufferings. And there is a time in our lives when our world crashes in. It stems from rejection, disappointment, or sin. In my case, disappointment. We feel as though not a soul could understand where we are at this point when the flood rushes in. Many smiles could surround us in a room, but we still feel the weight of life's impending doom. All alone we feel in this battle of life, ripped apart inside by heartache and strife. Wounds too numerous to count from all the years, each one representing all of our tears. But Jesus was there as each tear fell, as we felt all alone in our own hell, feeling that life's battles have stripped us bare, leaving us exposed to a world that doesn't care. Though in our suffering we feel all alone, it's through our weakness we are made strong. The plans of God are not the plans of man. He turns problems around that we can't comprehend. God uses every difficult place where we've been to strengthen our faith and help others turn to Him. As we surrender our life completely to Him, He heals every hurt with His nail-scarred hands. Let His blood wash over the wounds of your heart and bring a refreshing and a new start. His promises still remain true, each one of them spoken for me and for you. They will come to pass if only you will allow, but the time to begin, it is now.
It's beautiful.
And that was it. Thank you. That was in the midst of just a lot of pain. A lot of pain.
It's just beautiful. Now, we need to type that up and put that somewhere. People need
I have it on a blog.
You do? Okay.
Yes.
There we go, Peeps. What's your blog?
I haven't really done anything with it in a long time, but it is deliveredfromfear.blogspot.com. Deliveredfromfear.blogspot.com.
We have a lot of talent amongst our peeps, do we not?
Thank you. I think so. From what I've seen on the other interviews.
We just need to get a little place that's big enough for all the peeps to be together with all our talents.
I just want to encourage people because people are going through hard things with these vaccine injuries. It's awful.
It is awful. It is a disgrace. Well, is there anything else you would like to tell the people? They're saying you're lovely.
Thank you so much.
I love you.
Thank you. Just know that if you keep your story to yourself, I know it's hard and it's painful. It can't help anyone, but if you speak out, you could save lives. You could save babies dying from what they're calling SIDS. It's not SIDS. You could save other parents from having to go through what I've gone through, what you've gone through. So
yeah, someone says you've got a lovely voice. You have a very soothing voice.
Thank you.
Someone's saying you'll be a good minister.
I'm in ministry school.
You are?
Yes. The university.
Goody.
Christian leadership with an emphasis in Christian counseling.
Well, they just love you.
Thank you.
Okay, so You guys haven't written their names. Have not written their
We
names.
have not written our names.
Okay, go
yet.
and get a number from. It's pouring with rain, so I don't know how that's going to happen, but I guess you're going to get wet.
That's right.
Okay, guys. We have Marcella coming on the bus in a minute, so we'll have a little chat with Marcella. We're going to come off right now.